At the urology team, we really take a team approach. All my partners, we all specialize in urology, but each of us have our own unique specialization. Mine is in cancer. Our philosophy is really to make sure that we're pushing the envelope, that we're not really just practicing the standard of care. We want to go beyond that. We're always looking and searching for newer technologies, newer innovations that will provide world-class care right here in Central Texas.
When you ask for the results of a cancer test and they tell you it's cancerous, the first thing that goes through your mind is your own mortality, because you start reading and reaching out to people and you find out a lot more information. Once I started that journey, it's heartbreaking because you think of your kids, your family. What am I going to do if it turns out that it's out of my prostate, it's spread into my body? So all sorts of things go through your mind.
Wayne and his wife came to me in a dazed and confused state. The initial person he saw said you need to do X, Y, and Z, and really didn't present him many options. I think that's the problem traditionally, is that we just go down that pathway, and we need to really take a step back and breathe and really assess each individual as an individual.
The first time I met Dr. Giesler, he told me that I didn't have cancer, that my prostate did. And from looking at the information he had at the time, he thought we needed to be quick about what we was going to do and that we should probably use the robot and take it out. He gave me that option or a couple others, and I chose to go down that road with the Da Vinci, which is a blessing in disguise because it all worked out in my favor.
The traditional treatment options for prostate cancer are surgery, and most of them are done these days robotically. There's several forms of radiation. And then there's some newer technology, the use of ultrasound therapy, the use of cryotherapy, which is a form of heating or freezing the cancer. All these therapies are good therapies, but they're not for everybody. So our job as physicians and the team we brought together is really figure out what's the best option for them. Wayne really had a textbook recovery. He's done great. All his cancer was removed. He's currently cancer-free. And really he's leading a very active and productive life.
I don't think I could have been happier with the results because I could control the urine and Eric was able to save the erectile nerves. I don't know how I could have been more pleased. We're going on 3 years here. My PSA scores all come back great. When you find out you have prostate cancer, the most important thing you can do is to research for the right team or the right group of people to give you your health care. I consider myself very blessed to have found Dr. Giesler and his team.